Hi, everyone. Welcome. We'll get started in about a minute. Give people time to hop on. Okay. Let's go ahead and begin. So welcome. We are at the end of the year. This is our fourth advocacy webinar of 2025, and we're so happy you're here to join us today. I'm Mandy St. Cooler, your Director of Partnerships and Communications, and I am joined by our Troutman Strategies team. Just as a reminder, as always, you are in listen-only mode, but we do encourage you to type your questions into the Q&A box, and we'll have plenty of time to answer those at the end of the presentation. The webinar is being recorded and will be available on our website and YouTube channel tomorrow. And before we begin, we just want to send a big thanks to our partners. Without their assistance, we would not be able to bring you this much-needed education. And now I'd like to turn it over to the Troutman team.
Thank you, Mandy. I'm Lindsay Austin, principal here at Troutman Strategies, and on our federal team, I'm joined by Chris Baxter and Ryan Diffley, our senior managers. I'm going to provide a little bit of an intro to tee it up. All of you are probably wondering what in the heck is going on in Washington and how is this happening? Believe it or not, things have been moving along even during the longest shutdown that we've ever had in our government's history. We were chugging along, talking to everybody, keeping tabs on stuff, ready when the lights turned on. And it's been nothing but full steam ahead, heading into the end of the year, where we do have some deadlines and things that are going to pop up, especially around healthcare. The most interesting piece of all of this is that healthcare has been at the center of it and will continue to be at the center of all discussions in Washington, leading all the way down to the ground level at the state. So going into an election year, you always have those sort of pivotal topics. So we'll get into all of that, but if you could jump to the next slide, I'll talk through the agenda where our trustee team will get into the details and nitty gritty. Those details and nitty gritty include our legislative priorities update. We'll get into some specifics on all the legislation we've been tracking for the organization and making sure you guys are a part of the conversation. We'll talk to you a little bit about diving into the reopening of the federal government, what that looks like, how we've sort of gotten through these challenging times and figuring out how, if there is another shutdown, which inevitably there could be, a partial one at minimum, what does that look like and where we are now? What does this ACA premium fight look like, and how is healthcare affordability, the discussion and the debate really happening in Washington? Where are they getting? Are they finding any conclusions? Still TBD, but I think we can dive into a little bit because it does impact the organization and the membership. Recent healthcare activity, some other legislation and things going on around Washington, not just on Capitol Hill, but in the administration. And then what we're going to be looking forward to in the second session of this Congress in 2026, where we'll have plenty to do. And I think they're going to want to show a lot of productivity in Washington so they can get reelected. And then hopefully we'll have some time for questions. We always appreciate the feedback from our audience and from everybody who's listening in. We know that you're busy as well and that you're taking the time to hear what we have to say, and we want to make sure we're being good stewards of the information so you understand it. Some of it is quite complex, so we try to break it down in a way that's digestible for anyone. So I'll move on and hand it over to Chris, who can talk through some of the legislative priorities, and we'll do a little back and forth. That way you don't get too bored with any one voice throughout the entire presentation. But again, thank you for joining, and we hope that this is useful to you.
Yeah, thanks, Lindsay, and hi everybody. Good to see some familiar names in the chat there. Just to kind of set the table here, our last quarterly briefing that we did for you was solely focused on the mini act, so we didn't have an opportunity to update you on some of the priorities that we've been tracking throughout the year. The last time we talked about any of the bills that you see on the screen was actually all the way back in June, so it's been quite a while. So as Lindsay said, we really wanted to kind of kick this off with what's been happening with those 2025 priorities that we've been tracking throughout the whole year. So I'll start with the Accelerating Kids Access to Care Act. Just to remind everybody, this is a bill that streamlines the enrollment process for out-of-state healthcare providers who treat children who are either on Medicaid or the CHIP program. And it requires states to establish a more uniform, simplified process where qualifying providers can join this program for up to 5 years. So this is really important because it helps reduce the delays in finding care for kids who really have complex heart conditions. So that's why it's one we've been tracking very closely. Back in June, these bills they were already reintroduced. They were reintroduced in both the House and the Senate earlier in the year. But there were kind of two significant updates for this one. Um, it was considered to be included in the budget reconciliation bill that was signed into law back in July. It was in the initial House version. Unfortunately, it was not included in the final bill that was passed in July. So that's something that's why we're still tracking it. But it has continued to build support in both the House and Senate. Back in June, as you'll see, there were 57 co-sponsors, and that's now up to 96. That's on the House side. And again, back in June, there were 34 co-sponsors on the Senate, and that's now up to 42. So this bill continues to gain bipartisan support. We think it'll continue to have support into next year. So it's one that we're going to keep our eyes on. That could easily move, once we get kind of past some of these more complicated issues that we'll get into a little bit later. The TROA, the Treat and Reduce Obesity Act, that is a new bill from June. If you'll recall, back when the Biden administration was first still in office back in January, there was a rule at CMS to potentially have anti-obesity drugs covered under Medicare. When the Trump administration came in, they ultimately decided to get rid of that rule. And that's why members of Congress were sort of waiting to decide whether they wanted to reintroduce the TROA to see how the Trump administration, made that final rule determination. So these bills were reintroduced in June in both the House and Senate, which is great. There's companion legislation by Mike Kelly, Raul Ruiz, Marionette Miller Meeks, and Gwen Moore on the House side, and Bill Cassidy, who's chairman of the HELP Committee, which stands for the Health, Education, Labor, and Pensions Committee on the Senate side. So, and just to kind of refresh again there, what this bill would do is it would allow CMS under Medicare to cover anti-obesity medications and also cover things like behavioral therapy also. So great to see progress there. But we'll actually get into some more drug pricing issues in a little bit. So more to come on that front. The Safe Step Act, this is also called Fail First. This is basically a health plan policy that requires patients to try one or more lower cost preferred medications before their insurance might cover a more expensive one. This is really important to us because it reduces those delays. If your provider, prescribes a brand name medication that he thinks is going to be right for you, you should be able to get that medication right away and not have to try these lower, perhaps generic drugs that might not be as effective before your insurance allows you to get back on that brand name drug. So this bill was reintroduced in September. This was one we've kind of been waiting for a long time. It was introduced in the last Congress, so we wanted to see it reintroduced again this Congress. Lucy McBath, Rick Allen, Marionette Miller Meeks again. She's on a lot of these. Raul Ruiz and Bob Onder were the main champions on the House side. Unfortunately, we're not seeing a Senate companion yet. That is something we're working on. We know there's champions in the Senate who want to see this get reintroduced, who have reintroduced it in the past. So again, that's going to be one that we continue to work on going into next year. Next up was changes to the Inflation Reduction Act. The key thing that we were looking at here was mostly along the Medicare drug price negotiation program. The Trump administration, when they came in, they're still looking at ways maybe they could tweak it. They're doing a lot of things, again, which we'll talk about a little bit later on drug pricing outside of the Inflation Reduction Act that they can do to help lower drug prices. But one thing that did happen earlier this year, again, this was in the Republicans' budget reconciliation bill that passed in July, was they included the Orphan Cures Act in that bill. And what that did was it amended the Inflation Reduction Act to exempt drugs from the Medicare drug price negotiation program that treat one or more rare diseases. That's an important distinction because previously they were only exempt if they treated one rare disease. Now, if companies want to experiment and develop the same drug that might treat multiple diseases, that can now be exempt from the negotiation program. And we really wanted that to happen because we felt that without that exemption in place, there was unintended disincentives to discourage companies from seeking new uses for drugs that were already on the market. Our other fifth key priority for this past year was pharmacy benefit manager reform. There's a lot of bipartisan interest in both Congress and the administration to see some things done. We haven't seen a lot done on the legislative side for this yet, but again, there's still interest there. But again, one thing I will mention was that in the reconciliation process, they placed a ban on what's called spread pricing. And what spread pricing is, it's the difference between what a pharmacy benefit manager charges a healthcare plan for a prescription drug compared to what it pays the pharmacy for the same drug. So they keep that difference for a profit. That's one way PBMs make money. And this can significantly inflate prescription drug prices. So just to put that in really simple terms, a PBM might charge a health plan $100 for a drug, but then go and only pay the pharmacy $80 for a drug and pocket the $20 difference. And that's what's called the spread. And why this is really important for us, for patients, is because it can create more transparency in that drug pricing process, which can hopefully ultimately lead to lower out-of-pocket costs. So that's a quick overview on what our priorities were. I will turn it over to Ryan now for the next couple slides for some more healthcare updates.
Yeah, great. Thanks, Chris. Again, it's nice to see everyone in the chat. Ryan Diffley with Troutman Strategies. Reopening the federal government. So as you likely are aware and saw on the news, the federal government shut down at the end of the fiscal year, beginning October 1st. What we experienced for, I believe, pretty much 6 weeks was, slow unraveling of government services. You probably mostly saw it if you ever had to do air travel, TSA slowdowns, air traffic control, things of that nature. So the federal fiscal year begins on October 1st and ends on September 30th. The House and the Senate Appropriations Committee's responsibilities are to pass the 12 annual appropriations bills. It's been several years since we've had regular order, and they've accomplished getting those bills passed into law before the end of the fiscal year. So the fiscal year 25, which just ended on September 30th, was actually concluded with a continuing resolution, which pretty much just states that all agencies are going to be funded at the previous year's funding levels. And so in FY25, we had flat funding. Now we're currently in fiscal year 26, and 9 out of the 12 bills have not been passed. And so that 43-day long shutdown, which was the longest in history, was ended by a group of 8 Democrats in the Senate who agreed to vote to reopen the government on a bill that provided continuing resolution for 9 of the 12 bills. And then 3 of the bills actually did pass across and got signed into law. And so that was the Ag FDA bill, which was critical for Mended Hearts and for y'all because, a lot of the research, of course, at FDA, drug approval, all of that. So that is a good sign for progress for us. Then Ledge Branch and Military Construction VA was also passed. And so those 3 bills are fully funded for fiscal year 26. Where we are now is the bill that was passed on November 12th kicked the can down to January 30th for the remaining 9 bills. And so agencies such as HHS, Defense, Labor, Education, a large chunk of the federal government is currently still operating under a continuing resolution. And so really what Democrats were fighting for and, which led to such an extensive or lengthy, shutdown was it all centered around the Affordable Care Act premium tax credits, which are set to expire at the end of this year. And this is something that, Senate Democrats were really pushing to get an extension on. And so the 8 Senate Democrats that ended up voting to reopen the government got a provision or a promise from Senator Thune to vote on these ACA credit extensions before the end of this month. And so this is where we are now. Chris, I think we can go to the next slide and we'll cover more about the ACA credits. So as I said, I mean, Senate Democrats, we're fighting to expand or extend the Affordable Care Act premium tax credits. Back in 2021, these premium tax credits were generously expanded because of, the American Rescue Plan. There was a need during the COVID outbreak and pandemic. And so there was a lot of effort there to try to ensure that Americans of all means could get on and insure and be covered. That is set to expire on December 31st of this year without any congressional action. And as many of you have probably seen, and if you are on an ACA plan, you may have already, and more likely, you probably have seen what your premium will be in the new year. And so there's a lot of frustration and concern about who's going to be covered, who's going to be able to afford those rising premium costs, and the general shock to consumers and what it means for patients. And so, you're going to see higher costs. I think a lot of families will probably choose not to be covered this coming year. And so that means, care disruptions, lack of access to medical care. And so those are just things that are on the horizon that, Democrats and Republicans are trying to figure out a way to try to lessen the blow here. And so, again, going back, those 8 Democrats got a promise from Senator Thune to vote on a clean multi-year extension before the end of this month. And so it is likely by the end of next week that Senator Thune will put a clean extension on the floor, but that doesn't necessarily mean that it's going to actually pass into law. It is highly unlikely that it'll succeed. There are other senators, such as Senator Hawley from Missouri, who has proposed legislation to provide tax credits to all Americans to cover up to $25,000 worth of your healthcare needs or expenses annually. There is Senator Bill Cassidy, who is head of the Senate Health and Education Labor Pension Committee, which, of course, in the name health, covers a lot of the healthcare policy. But he's proposed legislation that would expand health savings accounts. And instead of taking this premium tax credit and providing it to the insurance company, he would rather see it be provided directly to Americans through an HSA. That's highly unlikely at this point to pass. Really, it's coming down to the fact that they're in a time crunch. I think Democrats are united in needing an extension, but Republicans are divided on solutions here. And the president has not really stuck, really has not put a position for Republicans to coalesce around. And so at this point, 4 days into the month, we'll likely see that vote on a clean extension. But I think, at the end of the day, it's going to have to be something that is, a 1 year extension, not a 3 year extension, limits fraud, abuse, and maybe even limits the accessibility to, depending on income and things of that nature. But Chris and I and the team are tracking it. There's a mad dash, of course, before Christmas and the holidays to get these things taken care of. And sometimes that pressure is what members need to, get this sort of legislation across the finish line. Chris, I'll throw it back to you for the next slide.
Thanks, Ryan. So while that's all going on, there has been some other activity both um, in Congress and the administration that we want to highlight for you. So, as Ryan mentioned, there were a handful of spending bills that were passed as part of the process of getting the government reopened. One of the major spending bills that has yet to be resolved or passed is the Labor, Health and Human Services education spending bill. This is one of the largest, if not the largest, outside of the defense spending bill that Congress has to get passed every year. So that's one of the reasons why it's the most challenging. But as the name implies, it also has some of the provisions that we care the most about because it's the healthcare programs under HHS. And so, we want to see that done, but they're considering putting it together with some other spending bills as the next tranche of keeping the government open. But we'll see if they can actually make that happen because as I said, it's often one of the most controversial. It's one of the most expensive. So it is always a challenge year after year to get that one passed. But there are some really important things that we care about in that bill. Like I said, one of those things is NIH funding. There was a lot of concern, rightly so, at the beginning of the year with what the Trump administration was going to do with the NIH, with the funding at NIH, what programs they were going to research. Fortunately, Congress took a much more moderated approach towards how they want to fund the NIH. In fiscal year 25, which was the last fiscal year, NIH had $48.3 billion in funding. So what happens is the House and the Senate both put forth their recommendations for all these agencies for the next fiscal year. So what the Senate did in their bill was they actually recommended a slight increase for NIH for next year at $50 billion. And on the House side, there was just a small decrease that they were requesting, which was for $47.8 billion. And of course, this is a far cry from what the president's budget request was, which was nearly a 50% cut down to $27.9 billion for the NIH. So, seeing the House and Senate come to those numbers is encouraging. They'll have to reconcile those numbers to get a final bill passed. So, hopefully we'll see a final number somewhere in between that $47.8 billion and that $50 billion. But we're happy to see, Congress take a more moderate approach to how they're dealing with the NIH. And also, there's a lot of really good language that Congress is encouraging NIH to do research. They're encouraging NIH to do in these bills. They put what's called reports alongside these bill texts, and it's really just additional language that these committees put together to sort of, encourage agencies, departments to look at certain things. So in this case, the Senate and the House Labor HHS reports included strong language for the National Heart, Lung, and Blood Institute, which is an institute within the NIH itself, to support research for mitral valve prolapse, valvular heart disease, cardiomyopathy, cardiovascular disease, congenital heart disease, and COPD. So it's really great to see Congress taking interest in all of these heart issues. And as I'll talk about a little bit just on the next slide, this is something that we're going to be continuing to look at for fiscal year 27 also. Another thing, obviously, Congress is doing, as Ryan was just talking about, is holding hearings on healthcare costs. Senate Health Committee just held a hearing yesterday to discuss this very topic. Ryan already covered this a lot, but mainly we wanted to let you know about this hearing because, these negotiations aren't just happening behind closed doors. They're having public discussions about the best way forward on these. It's obviously very challenging to come to a consensus, especially in a sometimes contentious public setting like a congressional hearing, but they are happening. So, there's a lot more to come there. And as Ryan said, we're continuing to monitor it and we'll keep you updated. I referenced this on my first slide. There's been a lot that the Trump administration has been doing for drug pricing. Just a little last month, I believe, the Trump administration announced a deal with Eli Lilly and Novo Nordisk to offer discounted prices on GLP-1 drugs. These are obviously important for health patients because they can reduce the risk of major cardiovascular events like a heart attack or a stroke. And they're pretty significant price reductions also. They're down to $245 a month for Medicare and Medicaid if the state opts into the Medicaid program with a $50 Medicare copay. And there's also a lower cash price option if you buy these drugs through Trump RX. So that's kind of what I was referring to earlier about the administration doing a lot more on their own outside of the Inflation Reduction Act to help lower drug prices. Another thing really interesting, in my opinion, that they're doing, it's a little bit of a broader effort by the administration, by CMS, to test what's called a drug payment model. And basically what they're doing is they've created this voluntary program sorry, this isn't on the slide, by the way. I'm just kind of speaking off the cuff here. It's a voluntary program for drug manufacturers and state Medicaid programs to participate, where they will have access to what's called most favored nation level prices for the participating manufacturers' drugs. I know it's a lot. What most favored nation drug pricing is it's basically just a policy that aims to lower drug prices in the United States by linking them to lower prices that other developed countries paid or pay. This is something that the Trump administration wanted to do during their first term. They didn't really get much progress on it for a number of reasons. There was pushback in Congress, but it's now something that they're actively doing. I actually just saw today, I think it was Senator Hawley, if I'm not mistaken, introduced new legislation to also put most favored nation drug pricing into law. So that's something, the difference between an administration doing it on their own and then having this put into law is that a law is obviously much harder to reverse. So, not a lot of progress there yet. It just got reintroduced. So probably more to come on that. Next, there's been a lot of activity in Congress lately regarding the Organ Procurement and Transplantation Network. There's going to be a hearing on Senate Help on December 11th. So we can report on that one on a later date. But this follows a hearing on the House Ways and Means Oversight Subcommittee that just happened last week. And again, this follows a September 18th announcement from HHS, where for the first time in history, they actually decertified an organ procurement organization in Florida because they just found rampant, malpractice and inadequate training at that OPO. So again, first time in history that's happened. So, on the Senate side, Senator Wyden from Oregon and Chuck Grassley from Iowa have really been spearheading this effort to get reforms done. And the Ways and Means Committee has taken a lot of this effort on the House side. We don't see this criticism letting up anytime soon. So again, it's something we continue to monitor. Not really any major changes from a legislative perspective recently, but that step by HHS to decertify that OPO was certainly a big one. Next slide, please. Okay. This is exciting for us. We've talked about what our 2025 priorities were, but we are starting to look ahead to what we want to do for 2026. We have a few that we're going to keep on the books, which I'll mention. But I think really exciting for us is we're turning our attention to a couple other really key pieces of legislation that we want to influence and advocate for. So the first one is the Mini Act. We had a big policy presentation on this in September, where we had we had staff from the House sponsors of the bill, Congressman John Joyce and Congressman Don Davis. They're the key leads on the House side. We had staff come and talk about this bill. And really what this does is it promotes innovation for genetically targeted technologies, which are often used to treat heart disease management by increasing their market exclusivity period from 7 to 11 years. This just puts them, excuse me, this puts them on the same basis as other drugs that are already under the Medicare Drug Price Negotiation Program. So it's not really giving them any special treatment necessarily. It's just putting them on par with other drugs in that program, and it's really meant to keep that incentive for drug companies to research and develop these drugs that take a really long time and are really expensive to develop. So we're going to continue to advocate for that one, as well as try to find a champion for it in the Senate. The second new priority that we're looking at is the 340B program. This is a federal program that requires drug manufacturers to provide outpatient drugs at a significantly discounted price to eligible healthcare organizations, such as particular hospitals, federally qualified health centers, and other healthcare providers that typically serve low-income individuals. Excuse me. And why this program exists is because hospitals are really meant to use these savings to either provide discounted or expanded services to their patients. But one of the key criticisms of this program is that hospitals or healthcare systems or whomever might be receiving these discounted drugs aren't necessarily using those savings to provide those expanded benefits. So this is a program that Congress is looking at pretty closely. They're really starting to ramp up their oversight of it. On October 23rd, the Senate Health Committee held a hearing to examine the growth of this program and its impact on patients. And one of the major criticisms that came up during that hearing was the law that created the 340B program. It really doesn't require healthcare providers to actually use those savings to increase care services or provide discounted care services. So that's a new one that we're going to be looking at. We want to find ways to make that program more transparent, make sure that the savings that these healthcare providers are receiving from discounted drugs are actually passed on to patients. It's not just the health committee that's going to be looking at this. It's going to be on the House side too. So there's going to be plenty of ways for us to advocate for changes next year. And then finally, the third new one that we really want to focus on is NIH research. We want to really advocate for sustained or increased funding at the NIH, really focusing on the National Heart, Lung, that should say lung, not lunch, sorry, and Blood Institute. And this may include, advocating for what's called congressionally directed spending, or earmarks, as it's formally known, in the Labor HHS fiscal year 2027 bill. And then the two that we really want to keep on the books because they have such good momentum is the Accelerating Kids Access to Care Act, which I already talked about, as well as the Safe Step Act. Next slide, please. So I'm not going to go through all of these. These are all letters that the Mended Hearts has submitted over the course of the year. We really just wanted to demonstrate that we're not just focused on those 2025 priorities that I mentioned earlier or the 2026 priorities for next year. We keep our eye on a lot of different topics. A lot of these letters get sent to the Mended Hearts, to Mandy, requests to sign on to. Some of them we've taken our own initiative to send a request to the Centers for Medicaid because they're messing with a pricing for a service or something like that. So again, I'm not going to go through all of these, but please read them when you see the slides come through because there's a lot of things that we cover. There's a lot of things that the Mended Hearts team internally cover and respond to. So it's just good to see the whole a larger breadth of the issues that we're tracking. Next slide, please. And finally, I have to make a plug for our Hill Day next year. We had a great time with the Mended Hearts and the Advocates last year in February. We're hosting it again next year, sorry. for February 24th to the 25th. We just decided to have two more training sessions for that hill fly-in on January 27th at 4 p.m. and again on February 10th at 4 p.m. So please, I encourage you, if you're interested in attending our fly-in, it's a really great way to advocate for your issues. Meeting these staff in congressional offices, meeting members, it's a really great way to advocate for your message. There is no substitute for making that pitch in person. So yeah, I would encourage you to reach out to Mandy if you're at all interested in attending next year's fly-in. And with that, I will turn it over to questions.
All right, let's see. I don't think we have anything in the chat. I'm looking at the Q&A. I'm going to stop share. We'll get you guys up on Spotlight. There we go. I can see Q&A. So Steve asks, if you have any ideas on what we can do to move toward permanent extension, please let us know, other than writing to our representatives.
Yep.
That's the telehealth question he had.
Yep. I think one of the challenges there is I don't think it's because there's a lack of interest to do a permanent extension. There are like multiple bills that have already been introduced in Congress to do a permanent extension. I think one of the most popular ones is the Connect Act, if I'm not mistaken. So I think what I said in my original chat was that this is something that is just extended. It's been extended probably 5 or 6 times every time they pass a new continuing resolution or pass a larger government funding bill. So, it's almost like there's a lack of urgency to make a permanent extension just because it's been done so many times over and over again. I don't know if Ryan or Lindsay have anything to add to that.
I won't add to the policy function of it. One of the important things to remember is there rarely is an extension of a program that gets permanency without a major, major overhaul.
Yeah, that's a good
This
point.
is one that I think the permanency could actually end up being against your favor too. Like you try to see it both ways, where there could be a negative outcome where it gets set at a level that has to be revisited, and that's even harder to unwind. So it's almost like the continual chunk by chunk is going to be considered, and we're grateful for it. But at the same time, there's a hesitancy to lock it in current administration environment, and where there could be a switch in parties. It's just one of those things I think is being kept. But in terms of actual lobbying and advocacy efforts around it, I do think, and I have great friends with the head of the ATA. I think Ryan knows him as well. He used to be a Tom Price staffer and would be definitely willing to reach out to him and see if outside organizations like Mended Hearts, how they could participate in lending our name and our advocacy to their efforts, where they may have larger letters of support or advocacy events or certain members of Congress that need to hear from different dynamic organizations that provide new perspectives on telehealth and how significant it is. I don't think that any member needs to be reminded of how important it is, because if you can imagine during the shutdown when adults were and people receiving Medicare weren't able to access telehealth needs or get reimbursed for it, that was a really big challenge. So I do think that there's an angle for us to engage and be a unique voice to line up with the telehealth community. So let us add that to our list as an opportunity. We'll talk internally with the group to make sure that we're aligned with our priorities on where we want to make sure our voice is being lended in the right way.
Guys, I don't see any other questions in the Q&A. Do you have the three of you have any last thoughts that you'd like to leave us with today if we don't see any more questions come in?
I only thing I will add is that I really want us to look at 2026 through the lens of technology. through the lens of affordability and linking those two together, where AI and tech and telehealth, they've all been independent concepts. This administration is taking it very seriously in how we move into the actual 21st century in order to bring down cost of healthcare. And that means for the most extreme cases where heart and lung and cancer and diseases that are costing our government and costing our citizens a lot of money, how we can utilize technology to find solutions. So I do think this is going to be part of our narrative in the future, where we need to keep a finger on the pulse, which we do. We work with several different health tech related organizations, companies, tech-based companies that are working with the government. So I do think this is an opportunity to have a different lens, where we're bringing ideas and bringing examples and circumstances of where technology is being used by our advocates and by our sponsors, and how we can get behind those messages as well. So just a little bit of a future thinking, still maintaining our drumbeat on the traditional policies that we care deeply about that are still ingrained in mandatory spending or discretionary spending, but how do we look at ways to be a part of the efficiencies that Washington's trying to pursue?
Thank you, Lindsay. Appreciate that. And I don't think we have any other questions tonight. So thank you so much to the three of you for offering again your expertise. We're so grateful for your support. And thanks to everyone for being on. We hope you all have a great rest of your week.
Thank so much.
Thank you.
Thank you.
Bye.
Bye-bye.